Hi, my name is Carly, and I'm a registered nurse, and I wanted to discuss the controversial topic of vaccination. And this is going to be for my community health nursing assignment. And I will be looking over to a screen because I wrote down my discussion so that I don't mess up. So being a health professional myself, I am all for the benefits that vaccines have had on the public health and currently have on our societies. However, I wanted to better understand the opposing and what information people are using to fuel their beliefs about the cons of vaccines. So I did some research regarding anti-vaxxers' point of view, and alongside, like the traditional beliefs of it causing autism or other neurological stunting effects, the majority of anti-vaxxers avoid vaccines simply due to negative side effects associated with them. So negative side effects including low-grade fevers, cold or flu symptoms, redness and tenderness around the injection site, muscle and joint pain, headaches, allergic reactions, etc. Despite vaccines being one of the most successful contributors to global health and are one of the 10 most significant public health achievements of the 20th century, the paradox between the frequency of side effects of the vaccines compared to the frequency of the actual illnesses leads people to believe that vaccines are unnecessary and are actually even more harmful. The distrust in vaccines has grown as the incidence of these diseases that vaccines prevent have become increasingly rare, and the side effects, although far less harmful than the actual disease, have become more common. An article published by the American Medical Writers Association touched on the consequences of anti-vaccine movements by stating, depending on the disease, the percentage of individuals required to be vaccinated to achieve herd immunity or a communal or community immunity ranges from 30 to 95% of the community. Individuals who do not vaccinate, whether they like it or not, are also a part of the herd, part of the community, and they are unprotected herd members, unprotected community members. And they rely on the rest of us who do vaccinate for their preservation. Not only are unvaccinated children at higher risk for developing vaccine-preventable diseases than vaccinated children, but they also put specific groups like children who are too young to be vaccinated, as well as the immune-compromised populations at higher risk as well. So, with recent events regarding the coronavirus pandemic, I feel like the discussion around vaccines is really, really important. Our government and health professionals are working tirelessly to treat a virus that is spreading like wildfire and is detrimentally affecting the health of our society and other societies around the world. Although this type of pandemic is rare these days, there was a time where these illnesses, just like this one, would cause terror and devastation for the world. Many of these diseases and infection had much more of an impact on the world due to their increased severity, especially without the help of our today's modern medicine. It is because of the development of vaccines that these pandemics in our history have become history, and health officials are working as fast as they can to create a vaccine for COVID-19 so it can also become a part of our history. Many anti-vaccine individuals have not lived through a worldwide health crisis, and they do not recognize the severity of the return of these illnesses can have on our communities and economy until now. Although this current pandemic of COVID-19 has brought so much negativity to our world, one positive, hopefully, could be a new perspective and change of heart for anti-vaccine groups. So that is my opinion. I am all for vaccines, clearly. And I kind of wanted to touch a little bit on the coronavirus pandemic that's currently going on as well. It felt weird to not talk about it. So I kind of wanted to tie that in. So let me know your thoughts. Let me know if that's something you disagree with, agree with, whatever you think.